Today I'm publishing Are We Caring for Our Carers? I've done this investigation under my own initiative powers, and that allows me to do an investigation even though I don't have a complaint, and it allows me to also do an investigation that looks at issues for a broader range of people rather than just one person. I've chosen to do an investigation into carers, unpaid carers, because this group of people in Wales are pivotal to our health and social care system. We know the pressures that health and social care in Wales are under, and without unpaid carers across the country, the pressures would be even greater. Welsh Government has indicated that from their figures, there will be by 2037, something like 16% of our population who are actually unpaid carers. So the importance of this sector is going to continue to grow. The Act indicates that an unpaid carer is anyone who's caring for an adult or a disabled child, and that could be a family member or it could be a friend. So it's a very broad range of people in Wales that are involved in caring responsibilities. The Act also says that if someone is a carer, they have a right to a needs assessment, and that their local authority should undertake a needs assessment to ensure that they've got support in place to allow them to continue their caring responsibilities. Given the importance of unpaid carers in Wales, I was concerned that the investigation showed that only a small proportion of carers actually had their needs assessed, and then even a smaller proportion went on to have support as a result of that needs assessment. More widely, it seems that carers don't know what their rights are. They don't know that they have a right to this assessment and to support to help them with their caring responsibilities. And where they do get engaged in the system, there are communication issues. It's quite clear that we can improve communications for them. We could set out what they can expect from their assessment, and we can set out better what they might receive in way of support from that assessment. Having said that, the 4 authorities that we investigated, we did see some really good practice, and we did see that assessments were appropriately done. My role as Ombudsman is to identify where services aren't perhaps being delivered properly and where things can be improved, and to offer recommendations for improving public services. So what arose from this investigation was that there should be earlier intervention and prevention with regards to non-paid carers. What this means is that they get the support early on, and we don't wait until a crisis point is reached before they're offered support. The second area which is important is that many local authorities contract out this work to third-party organisations, perhaps in the voluntary or third sector. But it's really important that if local authorities do that they monitor the services being delivered on their behalf. They still maintain that responsibility. It's important they have systems and processes in place to do that. It's also true that it's not just down to local authorities. The early intervention in identifying who unpaid carers are is a responsibility of all of us across the public sector, and particularly within health services. So services such as GPs, pharmacies, and those working in hospital environments will be able to help identify unpaid carers that should have assessments and should have support. So there needs to be greater collaboration between health services and local authorities in this matter. I've made other recommendations as well about ensuring that there's proper training in place for local authority staff on assessments and supporting carers, and also that there's better record keeping, data collection, and that they pay particular attention to equality data so that we understand who unpaid carers are and what support that they need. The learning from this report applies to all local authorities in Wales, and I would ask all of them to look at the recommendations carefully and to consider how they can implement them as part of their work. I'm also pleased that Welsh Government is taking forward a number of these recommendations as part of this work under the Ministerial Advisory Group. I'm grateful to all of those that have been involved in this investigation, to the 4 local authorities that work very closely with us, and their commissioned service providers and all their staff. I'm particularly grateful to the carers who were very generous with their time and shared their experience of being an unpaid carer in Wales. Thank you to you all.